Hi, this is Sharon again, and this video is New Lymph Nodes and Pain Part 4. I did make a 3 in which I was just about to meet a Dr. Robert Coleman, who is a ovarian cancer specialist at the MD Anderson Cancer Center in Houston, Texas. That was my first trip there. I drove there all by myself. Well, I did pretty good. And he worked in collaboration with my gynecological oncologist here in Austin at the Texas Oncology Center by the name of dun, da, 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 Ellen Blair Smith. She finally, I just had to make sure that I respected her wishes of privacy. She was okay with me sharing her name, so I'm going to tout it to the world. Her name is Dr. Ellen Blair Smith with the Texas Oncology Centers. And he and Dr. Smith, Dr. Coleman and Dr. Smith, basically, at her request, they decided that I should meet with them to see if there were any trial studies. And that was fine. Anything to help extend life another day for me is the objective nowadays, especially when you're living with stage 4 cancer. So nevertheless, after I arrived there, we decided to go ahead on the course that Dr. Smith had already administered to me, which was to stay the course of a weekly regimen of maintenance, which is the chemotherapy drug called Taxol. A weekly regimen of Taxol, once a week for 12 weeks. I've done this before. This is the second time after about almost 2 years out. And since I had such pretty decent results with it as far as extending my life a little bit, we decided that we would try to go that route again. Basically, I had planned not to do any maintenance though before meeting Dr. Coleman, because studies are very funny. You know, if you miss that fine line, that window, by either having chemotherapy when you shouldn't have had it, or not having it when you should have, you can be disqualified for any study that they have available at the cancer center. So that was the plan. I knew my PET scan showed that I had new lymph nodes. We knew that. And but we felt like we had time to hold out, see what Dr. Coleman had to present to us, and then we would go from there, since we had time. But no. On April 2nd, when I went in, or I'm sorry, let me rephrase that. On April 2nd, when I awakened, I woke in intense pain. And folks, let me tell you, that was something new to me. It was frightening. And if that pain from the lymph nodes was any indication of end-stage cancer without being medicated, managing pain, I was not looking forward to it. I just wasn't. I was scared, so I rushed in to see Dr. Smith that Tuesday, April 2nd, and I explained to her what was happening, that I felt new ones, the lymph nodes, they were painful, and she did prescribe pain management medication prescriptions for me. That helped a lot. And then right away, 2 days later, on that following Thursday, which was like the 4th of this month, I began my first weekly dose of Taxol. Now, the visit that I had with Dr. Coleman was very interesting. It was eye-opening. It showed to me, in speaking with him, that you have doubt sometimes about what you're going through in regards to treatment. Dr. Ellen Blair Smith is on cutting edge medicine because she wants to be. And I'm very, very grateful for her knowledge that she has shared and has bestowed upon me to help me carry on a little longer. I also appreciate Dr. Smith. I know I'm jumping all over the place. I also appreciate Dr. Smith because she is a very unique woman and doctor in that she is honest almost to a point of being very painfully honest. But you know what, folks? Hindsight is 2020, and I appreciate it because it gives me an idea of how much time I have to live, and it has allowed me to live, to experience things, to do horse riding, to speak Spanish. Yo habla español ahora. To get my first tattoo, to get ready for my zip lining, all of those things. So you have to take the good with the bad news and appreciate it for what it is. But long story short, so right now my regimen is this. I am going to do once a week maintenance of Taxol for 12 weeks. Tomorrow will be my third week, leaving me 9 more weeks to go. So far, so good. The lymph node pains, what they turned out to be, just as Dr. Smith had said, not that I doubted her, is that from some of my previous radiation treatments, there began to be, that was some of the side effect. It's almost like the radiation literally cooked some of the lymph nodes, uh, some of the areas that they cross through, and over time they do change. The tissues of the areas that the radiation passed through change. So that's why there was the toughness and the growing in the skin area. The lymph nodes are being affected in that the radiation damaged them to some degree, in which now my lymphatic fluid cannot do the uptake as well, and therefore some of it is trapped as it tries to come down. It can't really flow like it should. It's a bit scary, and that's some of the pain. And although there was pain, um, both doctors, I believe, from my understanding, believe that a lot of the pain may be a little of the cancer, but not as much the cancer just yet as it is just the lymph nodes being inflamed from the fluid collecting within them. So right now, that's where we are. It'll have to do, but I will come back with you and tell you the exact regimen that Dr. Coleman at the MD Anderson Cancer Center and Dr. Smith at Texas Oncology have kind of come together to let me know what's out there for me. Say in the event that my Taxol that I'm on currently at one day and one point in time stops working, then I was told that there will be other options that I can utilize possibly, and that there are wonderful treatments on the horizon to help maybe desensitize my body to some of the chemotherapy that I've had reactions to in the past. But I'll touch on all of those specifics later. So in the meantime, I'm still in limbo, but I'll take it, you know. Tomorrow's another day. So I hope that helped you all just kind of see what's going on. After the 12 weeks are done, we'll probably have a scan, and we'll probably take a reading of my CA-125 numbers to see if the Taxol indeed has worked. So that's it. And I hope I'm helping someone out there to understand this brutal disease. In the meantime, I hope you all have a great day. Thank you for checking in. And this is Sharon. I'm happy to be. Ciao now.